Recent advances in regenerative medicine show promise in using stem cells for organ repair and regeneration, but the technology is still in early stages and is not yet a reality for growing full, replacement organs inside patients. While some sources on Facebook have posted misleading information claiming this is already happening, it is a significant exaggeration of current medical capabilities. What is currently possible? Regenerating tissues. Scientists can use a patient's own stem cells to repair damaged tissues. For example, researchers have had success in animal studies and early human trials with regenerating damaged heart tissue after a heart attack or healing cartilage in joint issues. Growing organoids. In labs, scientists are growing miniaturized, simplified versions of organs, known as organoids, using human stem cells. These mini-organs mimic the structure and function of real organs and are used for research, drug testing, and modeling diseases like cystic fibrosis. 3D bioprinting. Using a patient's own cells and a biological scaffolding, researchers have successfully 3D printed small patches of functioning tissue, including human heart tissue that beats. While a full-size organ is still science fiction, this is a major step toward creating patient-specific organs. The significant challenges still faced. Tumor formation. A major risk is that stem cells could develop into tumors, teratomas, instead of the desired tissue. Ensuring the stem cells differentiate correctly and grow without forming tumors is a significant hurdle. Creating complex organs. Growing a full-sized, functional organ with complex systems like blood vessels and nerves is extremely difficult. Currently, scientists lack the technology to grow organs large enough to sustain themselves inside the body. Ethical concerns. The use of embryonic stem cells, the potential for human-animal chimeras, and the high cost of personalized therapies raise complex ethical questions that researchers and regulators are still navigating. Infection and rejection. Even with autologous, patient's own, stem cells, there is a risk of infection or the body's immune system attacking the new cells, especially in allogeneic, donor, transplants. The immune system's response to new or manipulated tissue must be carefully managed. Regulatory hurdles. Moving regenerative therapies from lab research to widespread clinical use requires extensive and rigorous clinical trials to prove safety and long-term efficacy. The regulatory process for these new treatments is still being established. Where the idea of growing organs inside patients comes from. The concept described in the Brain Feed Doctors post appears to be a misrepresentation of real but still experimental regenerative medicine breakthroughs. For instance, some researchers are using a technique where they inject programmed stem cells and biological scaffolding directly into an already damaged organ, where it is hoped they can regrow healthy.